Hey guys, I wanted to hop on here real quick and do a quick segment talking about tendinitis or tendinosis. We're going to be using the quadricep tendon as an example. We had a good question from somebody recently who thinks they may have had like a quadricep tendon injury and kind of what can they do to help heal that or expedite the healing process a little bit quicker. So I'm not going to give too much anatomy, physiology within this because I just don't think it's it's not really super useful. But in general, if we're just a quick anatomy, muscles, I think we're all pretty familiar with. Ligaments connect bone to bone, and then tendons are connecting the muscle to the bone. So, all of your muscles have some kind of tendinous connection to a bone. So in the quadricep, we have 4 muscles coming down the anterior thigh. That's going to hook into the patellar tendon, or the quadricep tendon, sorry. Then that tendon hooks into the patella, and then technically the patellar tendon is not a tendon, it's a ligament, because the patella is a bone and the tibia is a bone, so that's a ligament. It's just kind of mislabeled. But anyway, so not relevant. Basically, if you have a new injury, right, and it's within that kind of first initial phase, it's inflamed, you're having pain, and we'll talk more about pain in a minute because it may or may not really be relevant. But you're having some pain and inflammation. Like, what do you do, right? Because as soon as we all get injured, we're just like, shit. It's normally for most of us who train a lot, the injury itself, the pain doesn't even bother us. It's just the frustration of knowing that we're gonna have to be dealing with it and managing it for a long time coming up, and that's the part that sucks. So we can get these things to heal quicker if we kind of modify what we're doing, but there's a few things you need to take into consideration to not extend the life of the injury to the point where it just becomes a tendinosis. So a tendinitis is a true inflammatory process of the tendon. A tendinosis is a degenerative tendon, almost like arthritis of the tendon. I guess you could kind of think about it like that. And that's a stage we really don't want to get into because the treatment's a lot different. It's a lot more chronic. And there's a lot of arguments that really that tendon's never going to get back to normal. Now the loading capacity could get back to normal. But so all right, we've got an acute tendinitis. It's swollen, it hurts. There has to be a rest phase, guys. I know that nobody wants to really hear that, but there's got to be a resting phase after an acute injury. And I'm the first one to not want to let stuff rest, but that's just the reality of it, right? So we need to modify our normal training stimulus at some capacity. So that doesn't have to be we quit training entirely, because I'm a big believer that we heal quicker with some kind of movement than we would with complete rest. Bed rest has been shown to form as scar tissue, just like injury does. So we're definitely not going to be laying down normal collagen. Anyway, that's just not a good thing. So we do want to move. We just want to modify and deload the tendon that we just overloaded, because basically a tendon injury is not that different than a muscle injury. It just kind of it presents differently. But we have micro tearing, and you're always in that tear repair or wear repair phase in the body, to where we're creating these little stimulus tears that then spark a reaction in the body to repair and make the tissue stronger. The same thing happens in the tendon. It just typically gets denser more than bigger. A pathological tendon will become larger, but a lot of times your normal tendon just kind of becomes more dense. And again, remember, tendons truly act like springs. They are the springs of the body. So almost like if you had an elastic band and then a spring on the end of it, that tendon is the spring. So they still have some elastic properties. They're just not contractile like the muscle tissue is, to where they really lengthen and shorten voluntarily under a contractile principle. So where am I going with that? Anyway, so we got to let it rest. We got to modify what we're doing. Initially, I really do just like to do some ice. So we don't want to completely blunt our own body's inflammatory process, because it's helpful, right? The body has an inflammatory process for a reason. That's how stuff gets repaired. It's not as soon as we see any inflammation, It's just like freaking physiology whack-a-mole, and we're just trying to get rid of it. Just get rid of it. Like, that's what people want to do. They're like, how much NSAIDs can I take? I'm gonna go get a cortisone injection. I'm gonna get a prednisone pack. I'm gonna get whatever. Just get rid of this inflammation so I can keep training. And that's really not a good mentality, because that's the kind of shit that actually leads to these things becoming more of a degenerative tendon down the road, because they never really got healed. They just got symptomatically relieved, whatever you want to call it. But just because, so sidebar, a tendon that is painful is going to be pathologic to some degree. A tendon can be super pathologic and not have any pain. So those are not, does that make sense? Like, you can have a ton of jacked up tissue in your tendon and it feels totally fine. But if you have pain, your tendon's probably jacked up. If you don't have pain, who knows? It could be fine, it could be not fine. But that's where clinically it's kind of fun, because like we make, imaging is kind of not valuable with tendons sometimes, because like you'll image a tendon and it'll look like total shit, and then you'll rehab it, and like, you go through like a whole 3-month process, and then like it feels great, and the person goes and gets an image and looks exactly the same as it did before you did rehab, and they're like, oh my God, I'm never going to heal my tendon. And you're just kind of like, but you're doing everything you want to be doing. Does it matter? So, you got to decide what's relevant to you. But we're just talking about function and, again, trying to prevent the tendon from getting into that kind of a pathological process. So, one, let it rest a little bit. Let's take at least a week off of training the body part. So if it's legs, if it's a patellar tendon, let's take a little bit of time off training legs. That doesn't mean you can still probably train hamstrings. That's not really gonna, and that'll essentially be lengthening and shortening the contractile and tendinous junctions on the other side of your leg, which in my opinion is a good thing. We're still getting normal release of like some of our growth and endogenous growth factors there, which is a good thing. We're still getting blood flow to lower extremities, which is a good thing, but we're not really loading the tendon, which would be a bad thing. I do like icing it. So I think ice is about as much an anti-inflammatory effect that I really want people to put on a new injury, because I do think that blunts some of the over accumulation of inflammation that it can have, because inflammation in itself is acidic. So I mean, I want to have it in there when it's needed, but I don't necessarily want it hanging around too long. And I do think that we can sort of expedite the body's normal healing process if we know that we're not going to injure it again. Like, so we're taking the steps to say that if I get rid of this inflammation prematurely, earlier than the body would have on its own, I now have to take the responsibility to not go damage that tendon again just because it feels better. Because if it was up to the body, that shit would still hurt because you'd still have inflammation in there, but you remove it. So now it's on you. You have to take the ownership to say, I'm not going to hurt that tendon anymore. I'm going to be smart. But that will probably allow it to heal quicker. So, all right, back to that. So we're going to let it rest, and we're going to ice it for like 3 to 4, probably really kind of the first week. You don't have to ice it like a whole week, but kind of let it rest. Definitely massive deloading phase. You are not continuing with your normal training for the first couple weeks of a significant tendon injury. All right, so I'm assuming if we're talking about the relevance of this video that it's actually like a decent injury. And you, like, if you can feel it, it's probably significant, because like tendons don't talk to you quite as much as muscles do. They're more anaerobic, so they require about 7 or 8 times less oxygen as muscle tissue does, and so they're also slower to signal, I guess, if you could kind of call it like that. They're just slower in general. Like muscles get damaged, they heal really quick. Tendons are just a little bit slower to respond and to signal the body. So like tendon injury is another good thing to note. Like, you're really gonna feel the effects of what you did to your tendon more the next day. You're not gonna necessarily feel it like that day. Like, tendons will kind of feel good sometimes when you get them warmed up, but then you gotta like look at, well, how does it feel the next day to determine if you kind of overdid it, which is another part of this thing we're gonna talk about. So again, three kind of main things. One, we're going to deload, we're going to ice, we're going to get rid of a little bit of the inflammation so that we can start kind of initiating our own healing process. And then I do want you to kind of track your pain. So I don't think that this has to get super technical. If you look at the literature, they want you to be doing a single leg eccentric squat in a plantar flex position. So like toe pointed down, heel, or like a heel raised position of a single leg squat with the knee tracking over the toe. And that gives you that's a good repeatable assessment. And then you're kind of using a pain scale to determine, is my tendon getting more load tolerant over time? Okay, and again, so like I said, pain and tendon health is not necessarily super correlated, but you at least want the pain to be getting better, because that indicates that the tendon is more load tolerant and that your brain is at least reducing the threat signal of that tendon injury. So things are progressing as they should. So some kind of repeatable test that you might do every other day or something to look at, is that tendon more load tolerant? And you want the protocol to be really really consistent leading up to it. So maybe you do 5 minutes warm up. Some people will advocate for no warm up. I don't like the way that feels personally, and neither do patients. So I'll have somebody do like a very consistent 5 minutes on the bike. Then we're going to go do our single leg eccentric squat on a heel flex or heel raised position. That's going to be our retest every time they come in. How is that tendon feeling? Assuming their body weight's not drastically changing, which it shouldn't. So how's that tendon feeling? And then we want to look at how to start gradually reloading that tendon, or potentially taking some kind of more intelligent way of deloading it process. So like blood flow restriction training, this is a pretty decent time if you ever wanted to incorporate blood flow restrictive training or tempo training. So really slow repetitions, because again, a tendon responds more to quick loading versus slow loading. So if we're loading really slow, we're probably using a little less weight, and that is not going to bother the tendon nearly as much as if we're doing quick loading with either light or heavy weight, because the tendon's not as involved. Or blood flow restrictive training, again, we're dropping down the load a little bit. You can also look at different biomechanical ways of deloading it, in terms of better activation. If we're talking about the patellar tendon or the quadricep tendon, better activation of the posterior chain. So you might have more glute and ham days and less quad focus days. So if we're talking about how to deload the quadriceps, unfortunately, guys who are trying to develop your quadriceps, you can't train your quadriceps in isolation as much if you're trying to heal a quadricep tendon injury. And it should just kind of make sense. That's going to put more load. Anything that you're doing that's putting more load through the quadriceps is going to put more load through the quadriceps tendon. So things where we're activating more glute and ham dominant patterns are going to be good for deloading the quadriceps tendon, and they still allowed you to train. So the tendon is going to begin repairing itself within the first week. It's probably not going to be fully recovered for 3 months, because again, it's sort of slow reactive. It's just slow to get stuff done. The proliferation does not happen as quickly as it does in the muscle, and just those processes take a little longer. So those are kind of the 3 phases you want to go through. And I know this is kind of scattered, guys. I could probably sit here and talk for 2 or 3 hours on just tendon healing, and I mean, there's so many different individual circumstances that go into this. But the thing I do want to kind of give another sidebar on is why did the injury occur, right? We should either be able to see, maybe we just hit a point in our training where it was a little bit too much for the body. I would say more people injure their tendons during, obviously high training volume phases or heavy training volume phases. I would also say that more people injure their tendons during a bulk for our fitness athletes, because the body is just in a more inflammatory state. The higher amount of circulating inflammation that you have in your body, and the more, you could probably even track CRP and the blood levels, that C-reactive protein, and start to correlate that with itises that develop in the body. I'm sure that study's been done somewhere. But the more inflammatory your body is, and the heavier you're lifting and you're feeling stronger and things like that, you're gonna be more prone to tendon injuries. That's just the reality of it. But you you got to kind of take that stuff into consideration with your overall programming of your training. The other thing to think about is like, is there anything above or below where you got your tendon injury that might be predisposing you for a tendon injury? So like within the knee, if we're talking about a patellar tendon injury or a quadriceps tendon injury, patellar ligament, the ankle largely dictates how much force is placed through the knee, as does the hip. So say we're talking about a free squat, because if you start putting machines in and we change the biomechanics of the body, it's more specific to that individual machine. But if we're talking about just a free bar squat, if you lack ankle dorsiflexion, you're going to put more force through your knee, guaranteed. Because you don't have the proper mechanics, and when one joint loses its mobility or its proper function, the force is going to get transferred to the next joint up or two joints up until something can either change its position or modify that load somehow. Sometimes it ends up kind of going more up to the hip, but in general, the two major things I see with knee stuff: ankle dorsiflexion. If you're lacking that, you're going to be more prone to quadricep tendon stuff. And then lack of glute activation. If you lack glute activation, the more force that can be like distributed through the hip, so the better contractions and the more strength you have out of your hip muscles, the less force that the knee is going to have. The knee is just caught in between the ankle and the hip. So that basically what I'm saying is those two joints and those two muscular systems at the ankle and the hip need to be doing what they're supposed to do in order for the knee to operate properly, because the knee is just a hinge joint, more or less. I mean, it's more complicated than that, but it is largely just the middleman between the ankle and the hip, which are certainly more complicated joints. So really be making sure that your ankle mobility, your hip mobility is up to par, your glute contractions are up to par, which is all stuff that you can be doing in your deloading phase for the quadricep tendon as that's healing. So that deloading phase, in my mind, again, it's pretty individual, but definitely starting. So I would personally, if I had a significant new injury, I would try to really lay off of it and work other stuff, even within the legs, for probably 2 weeks. And then from like maybe weeks 2 to 6, I would be really slowly reintroducing exercises that are probably still more compound, but do involve that specific tendon or that specific muscle group a little bit more. And then from like 6 weeks, if everything's going right, like 6 to 8 weeks, you should be pretty pain-free again, or like even 4 to 6 weeks, you should be pretty pain-free. That does not mean the tendon is healed. The tendon's going to take probably at least 3 to 4 months to actually be healed, but you are just now load tolerant again. So respect that, and you probably need to keep your training a little bit smarter, or maybe not as quad isolated for a little while. I know that it's one of those things, not everybody has to be that conservative. It depends on the degree of your injury and the degree that your body is able to heal itself quickly, or past injuries on that specific structure. So there's a ton of variables that go into the like specific individuality here. But those are kind of the guidelines I would try to follow. I know I was kind of scatterbrained on this video, so guys, feel free to ask me for your specific situation a little bit more, and I can try to go into more detail, but there really is a lot of things to consider with this. So I hope this was helpful, but I guess let me just break it down. Like, if I was going to go through an exercise program for deloading my quadriceps tendon, this might be helpful. So hip thrust, I think you're pretty clear on that, as long as your feet aren't too close to your butt. So think about like pulling your heel to your butt. So our intent matters too when you're doing these exercises. If you're pulling your heel towards your butt on a hip thrust, that's going to deactivate the quadricep because you're activating your hamstring. You can obviously do any variety of hamstring curl. You can still do calf raises. Just be smart about how you're like loading that. You could definitely do like hyperextensions for glute development. I think personally you can definitely do stiff-legged deadlifts, and you can ease into deadlifting, again, probably towards the latter part of that phase 2, where you're starting to move from deloading to gradual loading, you can incorporate normal deadlifts. And then you're going to be getting back to more compound movements that equally distribute force between the quads and the hamstrings, like leg press or squat or lunges or split squats, Bulgarians or something like that. And then eventually, as you move out of that phase, you can start to get back to your hack squats or your front squats or your leg extensions or leg pressing with the feet down closer to the bottom of the platform, and the things that develop your quadriceps more as you're specifically trying to load those structures again with a little bit more focus and more intensity. So that's kind of how I would progress a rehab program. And to be honest, the duration of all that is very individual. Again, that's where kind of using your test-retest and making sure that your pain levels are consistently going down week after week on your single leg eccentric squat is really important, because if it's not, you shouldn't be progressing your phase. If your body's healing isn't progressing, you shouldn't be progressing either, and just being like, oh, it'll catch up. No, it won't. It's not going to catch up. It's going to turn into like a tendinosis down the road. And we can only lay down so much tissue at one point in time. It's kind of like, it's like hand sanitizer in 2020, right? So they were making a normal amount of hand sanitizer at the beginning of the year, and the shit was coming out pretty good. It smelled normal, it looked normal, it felt normal. And then all of a sudden the demand went way up. And all of a sudden the hand sanitizer you go buy at the store right now just smells like gasoline. I don't know what's going on with it, but there's not, the demand is exceeding what quality production can produce. And that's kind of how your body works. If we're trying to lay down so much scar tissue to fill in these micro tears, and we can't integrate it very well into the rest of our tissue, this shit's gonna look like a Spider-Man when he's spraying his big glob of web all over something. It's not gonna be uniform, it's not gonna be in line with the other fibers, and it's not gonna be very load tolerant, because that's not how the tissue is designed to lay down. It needs to be integrated into the rest of the tissue. So if you've got a haphazard looking tendon, it's probably gonna feel pretty haphazard too. So that's the where, again, if you're more in the tendinosis category, you do need to get in to see somebody for a little bit more hands-on approach, where we can kind of work on the integrity of the tendon and start to maybe bridge the gap for what just exercise programs, in my opinion, are good at doing, and then what manual therapists are good at doing. So I hope this was somewhat helpful. Sorry for the sidebars and the lack of focus. I don't really have a PowerPoint presentation here, but I'd be more than happy to talk with anybody about this in further detail if I can, and hope you're all having a great Saturday. Enjoy the weekend, and till next time.